The topic of my research proposal is course-integrated library instruction and the information-seeking behavior of third-year medical students. The research question that I have been investigating throughout this semester is, to what extent does course-integrated library instruction impact the information-seeking behavior of third-year medical students? I am interested in understanding what typical information-seeking behavior looks like for third-year medical students both before and after receiving course-integrated library instruction. The purpose of my research is to investigate the extent to which cohesive course-integrated library instruction sessions impact the information-seeking behavior of third-year medical students. I am interested in this topic simply because it is the area in which I work. I work at a medical library, and I often help students and hospital residents with developing search strategies for their research topics. I was recently added to the training team as well, which means I will be more involved with teaching library orientation sessions. I am really interested in how library instruction benefits medical students and how we can improve our instruction sessions to help them be better researchers. I chose students in their third year both because there is a gap in the literature here and because these students are getting close to becoming medical professionals where they will need to be able to conduct clinical research on their own. My hypothesis is that if third-year medical students receive cohesive course-integrated library instruction sessions that are relevant to their research, then their information-seeking behavior will become more focused and efficient. When conducting my research, I focused on four main components of this topic within the literature: information literacy, information-seeking behavior, individual learning environment, and course-integrated instruction. Information literacy is a sort of foundation for information seeking. If students don't understand the terms and language surrounding the searching process, they will not be able to effectively use the tools available to them. Information needs also change as students become more invested in their field of study. They grow in complexity and sophistication. Because of this, information-seeking strategies must also become more complex and sophisticated. Some students may be brave enough to use advanced database features without any instruction, but if they do not know how to use them well, these features might only serve to interfere with the search rather than help the student. The learning environment is also an important factor for effectively teaching students information literacy. This environment is not only physical, but also cognitive and emotional. The way students perceive knowledge and how knowledge is gained impacts how they respond to new information and information-seeking skills. Those who understand information as necessary and believe it is accessible are more likely to be open to learning sophisticated information-seeking strategies than those who see it as inaccessible and difficult to use. In regard to course-related library instruction, this has been shown to be more effective for older students than for younger students. However, much of the literature is divided on its general impact. It seems most effective when directly related to students' research and coursework, especially when multiple sessions are offered. In order to assess the impact of course-related library instruction on the information-seeking behavior of third-year medical students, I have designed a mixed method study. I will use a questionnaire to collect quantitative data, which will assess information-seeking attitudes and allow for comparison and analysis to validate qualitative findings. I will use interviews to collect qualitative data about what resources students use and how much they search and how they search for information. Different portions of this study will take place in different settings on the university campus. The initial library instruction session at the beginning of the semester will take place in the classroom, while the second session, which will take place midway through the semester, will occur in a library classroom. The questionnaire will be distributed to each participant's email, and the interviews will take place in a library conference room. Since this study is aimed specifically toward third-year medical students, a selection of these students will act as the participants. An instructor who teaches a mandatory research course for medical students in their third year invites reference librarians to teach a library instruction session at the beginning of his class each year. With his permission, his class will be invited to participate in this research. The entire class of 60 students will receive initial library instruction as usual, and 24 of those who attend will be randomly selected to participate in this study throughout the remainder of the semester. Both the questionnaire and interview will be employed twice. First, at the end of the semester, after participants have received both library instruction sessions, and again at the end of the second semester without having received additional library instruction. This is to help assess the long-term impact of library instruction on information-seeking behavior beyond just the semester in which the students received the instruction. The questionnaire will be used to collect quantitative data about the participants' information competency and overall confidence in their information-seeking abilities. This instrument is already established and validated and has been used in 2 studies at 2 separate universities. It asks 40 questions, which participants will answer using a 7-point Likert scale. The scale ranges from strongly disagree to neither agree or disagree to strongly agree. The questions are written in a way that allows students to express their perceptions of the accessibility of information and their ability to use it. The interview will consist of 8 questions aimed at the information-seeking process. These questions are adapted from the interview questions used in a study that addressed the influence of library instruction on the search behavior of first and third year students. The key concepts covered in these questions include how students search for information, how they choose their sources, how they develop search strategies, which sources they know about, and how they use the information. Each participant will attend a second interview at the end of the second semester of the academic year in order to assess any changes that may occur after a longer period of time without formalized instruction. In conclusion, the goal is for the various components of this research study to work together to address how library instruction currently informs information-seeking behavior and how instruction may be improved in the future to better meet students' needs. The focus is on the students and how we can help them achieve their research goals and meet their information needs, both now and throughout their medical careers.